disorder used to be called manic depression. As the older name suggests, someone with bipolar disorder will have severe mood swings. These usually last several weeks or months and are far beyond what most of us experience. They are low or depressive, which are feelings of intense depression and despair. High or manic, which are feelings of euphoria, elevated or expansive mood. Mixed, which is characterized by depressed mood with the restlessness and overactivity of a manic episode. What causes bipolar disorder? Research suggests that bipolar disorder runs in families. It seems to have more to do with genes than with upbringing. There may be a physical problem with the brain systems which control our moods. This is why bipolar disorder can often be controlled with medication. Episodes can sometimes be brought on by stressful experiences or physical illness.
Okay. Bipolar disorder is one of the major psychiatric problems seen all over the world. Basically, the causes for bipolar affective disorder, or earlier name for that was major depressive psychosis. Manic depressive psychosis, yani ki MDP. The major causes for this is biological. There are genes involved for it. There are changes in the brain for it. And also it is considered to have certain psychological and sociological factors involved with it. We call it a biopsychosocial model. However, the current understanding of bipolar disorder is mostly a biological illness, and the treatments are basically focused on that. One of the myths related to the treatment in psychiatric disorders is that psychiatric medications are very addictive. They cause a lot of sedation, and you need to take it for lifelong. Well, the truth is that not necessarily all patients need to take medications for lifelong, number one. Number two is that, yes, in initial phase, we need to give some sedation to the patient, for patient to calm down, for mind to calm down, for brain to sleep, initially, for it to get rest. But over time, we start decreasing the sedative drugs so that the patient can go back to normal function. There's no point to treat. Right now, the trend is to make a patient function and not just to make him sleep. That is the latest trend in treatment of psychiatric disorders. Another myth is that it could be because of some changes in the planetary systems. Nakshatra kharab ho gaye hain, ya some upri hawa hai. These are another myths surrounding this. So people do go for religious healers, faith healers for treatment of it. As a general rule, we don't usually resist people from saying, okay, you don't go and do that, but we definitely tell them to continue with our medication, which is very important.
In bipolar disorder, the feeling of depression is worse. It goes on for longer and makes it difficult or impossible to deal with the normal things of life. Most of the changes manifest in the form of feelings of unhappiness that do not go away, losing interest in things, losing self-confidence, feeling useless, inadequate and hopeless, thinking of suicide, losing appetite and weight, difficulty in getting to sleep, waking earlier than usual, feeling utterly tired.
Mania, on the other hand, is an extreme sense of well-being, energy, and optimism. It can be so intense that it affects your thinking and judgment. You may believe strange things about yourself, make bad decisions, and behave in embarrassing and harmful and occasionally dangerous ways. Like depression, it can make it difficult or impossible to deal with life in an effective way. A period of mania can affect both relationships and work. When not so extreme, it is called hypomania. Some of the symptoms of mania consist of being very happy and excited, feeling more important than usual, getting irritated with other people who don't share your optimistic outlook, full of new and existing ideas, moving quickly from one idea to another, full of energy, unable or unwilling to sleep, more interested in sex, making plans that are grandiose and unrealistic, talking very quickly. Other people may find it hard to understand what you're talking about. Making odd decisions on the spur of the moment, sometimes with disastrous consequences. Recklessly spending your money.
The prognosis for bipolar affective disorder, the earlier recognition, the longer, the more continuous the treatment is, the better the prognosis is usually. If there is no family history, if patient has very good pre-morbid level of functioning, if patient has very short episodes, we recover very quickly with medications. If patient has a good inter-episodic recovery, then the prognosis is better for the patients. The worst prognosis, bad prognosis comes when people keep on relapsing because usually they stop taking medications or they underdose themselves. So it is very important for physician and the treating team to monitor the compliance for patient and to keep encouraging families to continuously, regularly monitor the medications and come for regular follow-ups.
Some researchers believe that mania, a defining symptom of bipolar disorder, causes creative activity. Scientists believe that bipolar patients' creativity stems from their mobilizing energy, which results from negative emotion to initiate some sort of solution to their problems. School of Medicine researchers at Stanford University have shown for the first time that a sample of children with bipolar disorder and children at high risk for the disease score higher on a creativity index than healthy children. The findings add to existing evidence that a link exists between mania and creativity. Some researchers believe that many people who have bipolar disorder become very successful, and these findings address the positive aspects of having this illness. Many famous people are believed to have been affected by bipolar disorder based on evidence in their own writings and contemporary accounts by those who knew them. It is often suggested that genius, or at least creative talent, and mental disorder are linked somewhere. Some of the famous people who have been affected by bipolar disorder are Jim Carrey, Carrie Fisher, Robin Williams, Catherine Zeta-Jones, Vincent van Gogh, Jimi Hendrix, Sylvia Plath, Virginia Woolf.
When you're galloping along at a great speed, it is better than any drug that you could ever take. God, if you will, is saving you parking spots. Songs are being played on the radio for you. You're just so enthusiastic about everyone. And everyone must be enthusiastic about you. And it's just come along. I've got a great idea. I've got this unbelievable idea. Let's go to India.
Exactly.
Then you'll just start going way too fast. And you're faster than anyone that you're around, and that's not fun. You're on the phone far too long, you're not getting any sleep. Nothing is going fast enough for you. Come on, keep up with me, you guys, come on. And even if it's not true that you're more talented when you're manic, you feel like you are.
Yeah, which is half the battle.
I am standing on rocks, flaming speeches to the world. You know, I have a lot to say. I have messages from deep space, in fact. And I stayed awake for 6 days, and I did lose my mind. This friend of mine says to me, "Does your doctor know that you behave this way?" What do you mean? Then we sort of have an argument, and I cry for 4 hours. and I'm unable to stop. And I know there's something wrong with that. I call this doctor, and I go in and I see her. You know, we're talking, and I'm laughing, and I'm spinning around in chairs. And the doctor says,
That's the diagnosis. That's bipolar. That's manic depression.
Following is a short role play on bipolar disorder. It brings out the salience of the symptomatology of the illness and the psychoeducation thereafter.
So, what brings you here?
Well, you see, doctor, my daughter.
Don't fuss, Mama. There's nothing wrong with me. Doctor, there's nothing wrong with me. I mean, I'm perfectly fine. I'm perfect. She's just being, the mother, overprotective.
Nevertheless, Meghna, since we're already here, let me just talk to the doctor.
Okay, fine.
Doctor, Meghna's been behaving erratically for the past few days. She's overly excited, irritable, impatient, restless, is talking too much, and is just too involved in her job.
What do you mean by too involved in her job?
Doctor, she's always at work, goes early, comes back late, and she's being told by her colleagues to go back home. And even when she's at home, she's constantly thinking about her job or is either sitting on the laptop and doing her work.
So, what's wrong with working hard? I mean, doctor, is there anything wrong with working hard? I love my job and I'm the best at my job. I mean, my boss gives me so much work because I'm the best at my job, right? And you know what, doctor? Just see, in 2 years, I'll be the first woman CEO in my office. You'll see.
So, you're confident that you'll get the top job?
Of course I'm confident. I mean, I'm the best at my job and I'm the most hardworking also. Doctor, I don't even need sleep. Like just 4 hours of sleep and I'm fresh as a daisy.
Right? Meghna, do you mind if I speak to your mother and sister alone? Can you wait outside?
Why? I just told you, I'm fine. There's nothing wrong with me.
Well, since they're already here, I'd like to speak to them. If there's nothing wrong with you, then there's nothing wrong with you. You have nothing to worry about.
I guess so. Fine. Talk to them.
Now, please, speak without reservation. Whatever you say will stay between us.
Doctor, she's driving me crazy. She's always interfering in my life, especially my work. She's always asking me, do I need anything? Do I need new books? Do I need her to make my notes? Even when I refused, she made my notes and gave them to me yesterday. Doctor is getting very annoying for me.
Has such a thing happened before?
Yes, it happened around 8-9 months ago. Meghna was in a different job then, but she behaved exactly the same. I remember she was again very excited, restless, impatient, a little argumentative also, and just too obsessed with her job. But I don't know what happened after that. She changed a lot. She stopped taking interest in her work. She started taking a lot of leaves, didn't complete her assignment, and didn't even stay in touch with her friends and colleagues. All she did was just stay at home and do nothing.
Were there any other changes in her sleep, appetite, other activities?
Yes, there were. She lost her appetite and she started sleeping a lot. In fact, she used to sleep half the day and the rest she used to spend while sitting at one corner and staring vacantly and doing nothing. She barely interacted with anyone, let alone her family or friends.
Did you try talking to her? Did she say anything?
We did try talking to her, but she said that she's feeling very low and unhappy, that everything around her is grim and bleak. And I remember she used to often cry while saying all this.
How long did this phase last?
Doctors say around 15 to 20 days.
Is anyone else in your family suffering from same problems or has ever had similar problems?
Yes, my mother had similar problems. She used to behave in the same way like Meghna's behaving right now.
Did you or your father or anybody ever take her to a doctor or a psychiatrist or a psychologist?
No, my father used to say that she's just like that, a little strange, but nothing wrong with her as such.
Now I'd like you both to listen to me carefully.
It is important how we deliver the information about the illness to the patient and the family. If we suddenly say them something, it may devastate them. We need to be very cautious in amount of information we're giving them. We have to understand that they are lay people and they hardly have any information about the illnesses, or they may have a lot of myths about the psychiatric disorders. So it's important for them, for us to start giving information in a slow basis, in a slowly over the time, as patient is recovering, as patient is getting better. Instead of saying things like ये तो बहुत बड़ी लंबी बीमारी है, आपको दवाई नहीं छोड़नी है, या ये तब उसका कुछ नहीं हो सकता है, तो बार बार होता रहेगा. Instead of saying such negative statements, it's better if we say, well, let's first control the current episode and then we'll talk about the long-term treatment, because relatives do tend to ask what is the long-term treatment for these disorders. But we can say let's focus on the current episode first, and then second, we also need to tell the patient and the relatives to be very careful about what are the early signs. Early recognition is very important in preventing full-blown episodes of mania or depression. Usually the early sign for any psychiatric disorder is decreased sleep or any change in normal routine functioning. So if family or patient notices patient is sleeping less or getting upset or irritated, there are early signs that patient is getting, and they should come back to the doctor earlier than the follow-up asked for. Also, we need to tell the patient not to abuse any substances, because it has been known that things like alcohol or cannabis definitely affects the illness. It may increase the number of episodes, and it may cause medications to not work as proper as they should.
What Meghna has, what she is going through, is called bipolar disorder. It is a mental illness, but that does not mean that she is mad or insane. It's called a mental illness because it affects the mind and consequently person's behavior and emotions. Bipolar disorder has two sets of symptoms, mania and depression. Mania, the phase that Meghna is going through right now, is a state that is usually characterized by elevated mood, increase in energy, increase in activities which are usually goal-directed. For example, Meghna is constantly focused on her work, her job, wanting to complete assignments, wanting to meet deadlines. So most of her activities have an aim, they are not random.
So doctor, how does this mania manifest itself, in day-to-day activities?
See, a person becomes increasingly confident, sometimes even overconfident. There are high-risk activities like reckless driving or spending useless amounts of money or indulging in foolish business investments, things like that. Has she ever done anything like this?
Oh yes, doctor. She has been spending excessively these days, She spends unnecessary amount of money on things that she doesn't even require. And she has suddenly developed a liking for bike riding. She takes the bike without asking anyone and she goes God knows where. And doctor, she has even been fined thrice for overspeeding.
See, these are all symptoms of a manic patient. Now, on the other hand, is depression. When a person is going through this phase, they usually suffer from depressed moods, lack of energy, lack of interest in daily life or activities, disturbed sleep, lack of appetite. All these symptoms that she exhibited when she was feeling low and unhappy, like you said.
Doctor, is it curable? Can she be cured?
See, bipolar disorder is a fluctuating but a chronic illness. A person usually suffers from mania to depression and has periods of lucidity in between. But it is a lifelong disease. However, with proper medication, therapy during her depressive phase, and most importantly, family support, her symptoms can be controlled to a large extent.
Okay. Of course, doctor, we'll do whatever it takes. Please tell us what to do.
Don't worry, there are very good medicines that will offer her relief. If she takes them regularly, along with therapy, she'll be fine.
Thank you, doctor.
Thank you. Thank you so much, doctor.
For the treatment of any psychiatric disorder, and now we're talking here about bipolar disorder, bipolar affective disorder, it's important to know the role of both medications and non-pharmacological methods like therapy and counseling. It's important because these are usually long-term illnesses. They can, cause a lot of disability in a person suffering from them. So medications play definitely a role in decreasing the current severity of symptoms, in preventing relapses. But to improve the functioning of the individual, you just don't need medication but also therapy. Therapy, family therapy for educating family members how to deal with this patient. Individual therapy for the patient to accept the illness and how they can work better with this illness. Knowing is like if anybody has diabetes or hypertension and any other illness also, they're working. Similarly, these people can also work if they take certain precautions and if they follow certain guidelines.
Treatment for bipolar disorder varies due to the fluctuating nature of the illness. During the depressive phase, antidepressants such as selective serotonin reuptake inhibitors, commonly known as SSRIs, and serotonin norepinephrine reuptake inhibitors, commonly known as SNRIs, are used. Moreover, ECT or electroconvulsive therapy is also used as a mode of treatment for depression. Severe depression with suicidal risk is the first and foremost indication for the use of ECT. The response is usually rapid, resulting in marked improvement. Lithium has traditionally been the drug of choice for the treatment of manic episode as well as prevention of further episodes in bipolar disorder. The usual therapeutic dosage is 900 to 1500 mg of lithium carbonate per day. Moreover, antipsychotics are an important adjunct in the treatment of mood disorder. The commonly used drugs include risperidone, olanzapine, and haloperidol. Although somatic treatment appears to be the primary mode of management in major mood disorders, psychosocial treatment is also helpful. These include cognitive behavioral therapy, which aims at correcting depressive negative cognitions such as hopelessness, worthlessness, helplessness, and pessimistic ideas and replacing them by new cognitive and behavioral responses. There are other therapies too, like psychoanalytic therapy, behavior therapy, group therapy, and family and marital therapy, which can also be useful.
Now, my final note to everyone who's watching this documentary: that bipolar affective disorder is a disorder like any other illness, medical illness present in any human being. That doesn't mean an end in itself. The life doesn't end with bipolar illness. There are a lot of productive people working in all sections of life. Whether it's media, it's politics, whether it's doctors, lawyers, engineers, accountants, laborers who have this illness and they're doing well, provided they're very vigilant about the illness and vigilant about the treatment. So all the best.